We're asking to engage the class so you guys can come up with the medical diagnosis that we're going to go into later and find some nursing labels that we can use. So I'm going to go ahead and start give you some information. Yeah.
Okay. All right. We have a patient who has presented, 78-year-old male, admitted on 4/18/2011 to Kaiser Long-Term Care for progressive decline in physical mobility. He has a history of hypertension, sleep apnea, and a rotator cuff injury with repair to the shoulder after a non-syncope fall. What is that? What do you see?
Level of consciousness.
Right. He is alert and oriented ×3. Temperature of 98.1 orally. Pulse of 79. Respirations of 14. Both blood counts. Would you like me to slow down?
Yes, please. Thank you. Always like this. Yeah. Okay. All right. They have a temperature orally of 98.1. Pulse 79. Respiratory 14. Blood pressure 106, 59. O2 stat is 94 on room air. And pain is 0. They are on a puree nectar diet with a good appetite. They are 5'10" and 190 pounds. They're incontinent of bowel and bladder. And they are bed and wheelchair bound. And they have intact skin with reddened area on lower sacral.
So you should be thinking about what kind of nursing diagnoses would you think of for this client?
All right. Now some of the current signs and symptoms that they're displaying. Let's see. Have a rigid muscle movement. Tremors.
Anybody have an idea?
Parkinson's.
Correct.
Good job.
You guys are so smart.
Looking for how we're fixing.
All right. So, obviously we have come up with medical diagnosis. What nursing labels can we come up with from this?
Impaired physical mobility.
Impaired physical mobility. Okay.
You drew those? Impaired skin integrity.
Okay, one time.
Swallowing.
Swallowing, okay, because
Aspiration.
they are on
Nectar diet.
pure nectar diet.
Someone said risk of.
Is that regulated as a blanch?
It's non-blanchable.
Impaired skin integrity.
Okay.
Could be intolerant.
All right. So we got 3 right
Those are
there.
our 3.
So we got, let's see, impaired physical mobility.
Now, which of these should be the priority?
Risk aspiration.
Yes.
Airway breathing surgery.
What do we got?
She said risk for aspiration.
I think the other one was that
Yeah, the impaired mobility, we've got risk.
Risk for falls.
What about impaired skin integrity? She's got a non-blanchable
We were,
Is
they
that-
said ask in the second.
Oh, I know, but is that concern? Is that a big deal?
I think physical mobility would be before that though. Her physical mobility begins in McDonald's.
And if you improve the physical mobility, you'll improve the risk for falls.
All right. I like that one. Okay, so I'd say that's the main priority we should work on. All right. Thank you, guys. Now we're going to go over the PowerPoint, give you a little bit of brief
Actually, this is probably in your way, isn't it?
information on it.
Is that this one here?
Next slide. Go to slideshow. Up. There you go. Come from the beginning. Yep.
Oh, you got the clicker?
Yep.
Oh, okay.
Okay, so obviously Parkinson's disease is what we are discussing here today.
Okay. Parkinson's disease was first discovered in 1817 by Dr. James Parkinson. He's a British physician. In his paper, he set forth signs and symptoms of disease, and it is named after him. He called it the shaky palsy. Pathophysiology disease. Parkinson's is a disease with a slowly progressively affects the movements of muscle control and balance. Part of the disease process develops as cells are destroyed in parts of the brainstem, particularly a crescent-shaped cell mass known as the substantia nigra. It's located deep in the brain, just above the brainstem, on both sides. Nerve cells in the substantia nigra send out fibers to tissues located on both sides of the brain, and there the cells release essential neurotransmitters that help control movement and coordination, particularly dopamine. Scientists suspect that for most people the cause is probably a combination of genetic and environmental factors. Genetic factors, scientists have identified 13 genes that are associated with Parkinson's and can cause the disease in certain families. If you have a first-degree relative, such as a parent or a brother or sister, you have a 2 to 3 times greater chance of getting Parkinson's disease. Some environmental factors, rural living, not quite exactly sure what that is.
Rural
Water.
living is when somebody lives out in the country.
Yeah, I mean, I know that, but I mean, what in the country, unless it has to do with fertilizers or pesticides. Well water, herbicides, pesticides, so that probably goes along with that.
All right, I've got the signs and symptoms. Early symptoms usually occur subtle and occur gradually over time. Affected people may feel mild tremors or